So let me introduce our speaker, Dr. Chapman. So Dr. Helena Chapman's received her PhD at the University of Florida, one of the first One Health graduates. She also has an MD and a master's, and so she's been working in this field for a while now. And as you heard earlier, she's working in a lot of geospatial context, but trying to put together some of these pictures in a bigger One Health context. So I'd like to introduce you. Take the floor. Thanks a lot.
Hi, well, it's wonderful to be again here at this One Health session, and thank you so much for coming and for Will and Blair for being able to put this session together. I'm excited to talk to you a little bit about today and really focus on our One Health toolkit as we enter applications. So using Earth observation data in One Health applications for societal benefits. I'm currently a AAAS fellow in the NASA Earth Science Division in the Applied Sciences program, and more specifically in the Health and Air Quality applications. What I would like to present today is looking at describing the utility of Earth observation data and how we can use that and apply that into practice, and also highlight the opportunity to be able to do One Health collaborations with this knowledge of this skill, and be able to look into scientists who work in Earth sciences and non-health sciences, as well as the health disciplines, and being able to use that in our One Health toolkit. I'm a AAAS fellow in the NASA Applied Sciences program. Our director, Lawrence Friedel, is here in the audience. And basically in our program, we're looking at discovering and demonstrating innovative and practical uses of Earth observations in organizations' policy, business, and management decisions. And in that effect, we look toward applications, capacity building, and mission planning. So looking at being able to develop and transition applications into the sustained uses for the decision-making, building skills in our end users who are in the US and abroad to be able to access that and use that towards societal benefit. And then looking at identifying the applications that we can use for the mission life cycle and integrate into our end users, and that they can identify how we can continue to design and develop our missions that will be useful for our end users. More specifically, I'm in the health and air quality applications. John Haynes is our program manager, and we work in a team with Sue Estes, Ali Omar, and myself into all the responsibilities within our applications program. And in this program, we're looking at promoting the use of Earth observations in air quality management and public health, so specifically looking at air quality standards as well as infectious diseases, looking at examining toxic and pathogenic exposures and any health-related hazards, specifically looking at risk, looking at supporting the application of Earth observing data and models, and looking at air quality standards, policy, and regulations that can, again, look towards societal benefit, and also addressing the effects of climate change and how that the data can help use the end users to be able to make better decision makers, whether managers or policymakers. In our applied sciences area, we're looking at taking the data from the bench or from those researchers and being able to apply that to the end users, to who needs that, so that those individuals can make the proper decisions, whether that be managerial, whether it be policymakers, making better forecasts, or even just different programs for response or recovery. So that's where we end up in this middle ground to be able to do that appropriately for our end users and be able to reach out to be able to have other end users be able to use our data. So my journey to this is I came, as Will had mentioned, I came from a pretty clinical background and public health epidemiology in international health. My PhD was from the University of Florida, focusing on tuberculosis control in hospital settings. So I came with that, and I'm very interested in continuing to expand my skill set. And in the NASA Applied Sciences program, there's an opportunity to have an exposure to Earth observations, which is another skill set. Previously, I had exposure to GIS, which is a certain application of remote sensing. So it's definitely an opportunity to become a better practitioner and have a stronger skill set, again, looking at that One Health toolkit. Healthy environments are essential to balance within our ecosystem, and we do not live just as humans. We live also with animals and health. And one of the leading environmental health risks to our ecosystem is the pollution, air pollution from ambient or household. The WHO reported in 2012 that there are 12.6 million deaths or 1 in 4, associated with working or living in unhealthy environments, and there are 6.5 million annual deaths, or 1 in 9, associated with air pollution. So this is an environmental condition that we do need to consider, and we have the Earth observations to use as one portion of our One Health toolkit. This can lead to an array of infectious and chronic diseases to this burden. All of us in the One Health community have done the different factors. Of course, these are just some of multiple factors, natural and man-made, that lead toward the health of our planet. So when we look at antimicrobial resistance and leading toward inappropriate antimicrobial prescribing practices in humans and animals can lead to resistance. When we look at the proximity of humans living with animals and the potential transmission for zoonotic diseases, when we look at the spread or the cessation of certain fumigation practices with Aedes aegypti and the propagation of disease and continued risk in the Americas region, when we look at the pattern of rural to urban moving and the development of megacities, which again, different types of risks, and just the ease of travel. So globalization, we can hop on a plane and be in another continent tomorrow, if not that evening. So many of our different factors to consider, we all know those, and this is not an exhaustive list. And then, of course, natural hazards. This, of course, are several of them to consider. So how can we continue to build our One Health toolkit so that we have access to multiple layers to be able to do, to fulfill our research or our practice objectives? And I love this quote by Albert Einstein, which really solidifies why we are practitioners. And I use the word practitioners because we are all working in our different fields in application. But to raise new questions, new possibilities, to regard old problems from a new angle requires creative imagination and marks real advance in science. And that's exactly why we're here today, representing different disciplines to come together and how we can solve problems together in collaboration through One Health. And that's what leads to this. So in my current fellowship, I have been immersed, and there's a significant learning curve about the extensive use of Earth observation data that we can use that I have been exposed to through my fellowship. When we look at technology and data, we have our cell phones. You can go into the field and collect data. We have different opportunities to be able to communicate with people from different geographies within our country and outside of our country through WhatsApp, through FaceTime, through Skype. We also have the opportunity to use different computer applications and to be able to analyze our data, and using the importance of ground-based observation data, so local observations that someone is in the field collecting data. But there's also an opportunity to increase our One Health toolkit by looking at Earth observation data. So in this picture, you can see the different Earth science missions. The ones on the top, which are in yellow and orange, are those that are in the future, in development, but the ones on the bottom in the blue are the ones that are currently orbiting. There are 18 satellites and sensors that are in the lower Earth orbit that help monitor weather, climate, and environment for these research purposes. And there's a total per year about US dollars of $2 billion that are invested into this. So it is a significant per year investment that we have that is open access to our end users. This is an example, the International A-Train, just to give an example of what we have. But there are 5 current satellites that go one after another. That's why it's called afternoon. They actually go across about 1:30 p.m. local time when it's going across on the Earth, on the equator. And they pass by through each other. So they are collecting different types of data, and many have multiple sensors inside of them. So you go from one all the way to the other, passing through each other. And the opportunity for that is that these satellites collect the data almost like a puzzle. So they collect them all across, and then that will give us an opportunity to have more data all across the world. And as you can see, this is an international collaboration between multiple countries to be able to obtain all of this environmental data. It gives us a global picture of our Earth. And the value of these observations are looking at these environmental constituents so that we can be able to increase our knowledge of our planet as well as our solar system, so that we can be able to interpret and the data for our respective research or program objectives and learn more about our land and our water and our air. And everything is linked. So when we try to pick out anything by itself, we find it hitched to everything else in the universe, is a very wonderful quote by John Muir as well. So again, how can we integrate and learn more about Earth observations? Through these observations, there's multiple ways we can use this as far as diverse public health applications. So looking at air quality standards, being able to forecast infectious disease outbreaks, interpreting spatial and environmental relationships, and then developing and modeling systems. I have some examples to present today of that actually in real practice. So this is just preparing for that. But again, focusing on what is our One Health toolkit and what do we want to, how can we strengthen that as well as collaborate with others. So first, looking at providing information to achieve shared global objectives, for example, the SDGs. So there are 17 different goals from the Sustainable Development goals that we had from the Millennium Development Goals, and these 17 have a lot of One Health components in the different areas of Earth. And we can also look at looking for strategies to be able to improve the communication among stakeholders as well as those who actually make those decisions. And also in this toolkit, learning what we need to continue to strengthen. So what kind of capacity building programs do we need that we can learn more about how to use Earth observation data? So to use a couple of real life examples that we have within our NASA program and some of our NASA funded PIs, to give an example of some of these clearly. So one is looking at harmful algal blooms. So some of these accumulations are harmful obviously to people and animals, but this data can help detect, forecast, and target responses by the appropriate authorities. So by one of the PIs from NOAA, Dr. Stumpf, he had this project for monitoring, forecasting harmful cyanobacterial blooms in Lake Erie. And he had prepared a study that was published in 2012 looking at seasonal forecasts of 2014. And so using the data, being able to model that again, developing and modeling the systems to be able to identify and forecast a potential algal bloom outbreak, which was identified in his paper for 2014. And so then in this timeline of events, which was using some data from one of the instruments, which is MODIS. In 2014, there was this timeline in Toledo, Ohio, which is looking at these algal blooms in Lake Erie. Then there was identified that in the western side of Lake Erie that there was a high elevation of cyanobacteria index. And so for that reason, Toledo finds the microcystis species in the water and produces a do not drink for their over 400,000 residents. That data was important. Then they were able to treat the water system accordingly with this knowledge at hand, and then they canceled the water notice, making the water being able to be drank for other individuals. So this was a very tangible tool that could be provided to the health authorities so that they can make the appropriate decisions for their population health. If you Google NASA and you can Google any of these, you are able to look at some videos and also read about these reports. Following that, the same PI thought this was able to be transferred to Florida, since in Florida, along the Gulf Coast from Texas to Florida, toxic algal blooms also occur traditionally in the late summer, early fall is that area. So the goal was to be able to report daily respiratory forecast for each beach on the Florida Gulf Coast, because these algal blooms can produce respiratory challenges for even susceptible humans, and as well as it can be harmful for the marine life. So in that the team used Earth observations of offshore exposure and they integrated that with some very unique tool, which is beach samples from a HAB scope, which is basically being able to use a filter on a camera so that anyone going to the beach could be able to take a picture with this filter and then be able to send the picture to the appropriate scientists, and then they can determine if it actually had algal blooms in the sample without actually taking a sample and without talking to the person. It's just with the cell phone. So it's a very unique tool to be able to use. And these different forecasts were disseminated, and using this data in combination with the sampling of this local sampling, that these respiratory distress forecasts were now being able to be produced 1 to 2 times per day along the Florida Gulf Coast and more accurate, instead of 1 to 2 times per week. So again, this is another real life example that can be used in the process. Another example is looking at being able to identify potential malaria outbreaks ahead of, to be able to track that and then be able to make the intervention before the outbreak. In the Amazon has approximately 90% of the malaria in the Western Hemisphere, and in Peru, 75% of these cases occur in a specific region of Peru, Loreto. And so the goal was to look to be able to develop a spatially explicit model of malaria transmission risk on the basis looking at predicted of Anopheles mosquito density and mapped human settlement and activity patterns. And so that's when the team was using, again, Earth observations to be able to identify the area of Peru, and then looking at the transmission risk modeling. So you can see in the different colors, the colors of the different districts of this area, and the local health clinics are actually in white circles. There are a couple limitations with this, being that even if you are bit does not necessarily mean you were at that health facility. So there is a slight disconnect with the health records and the actual bite of the mosquito, which obviously is a limitation to be able to consider in future research objectives, but it's definitely a start to looking at this early warning system for malaria risk. So some future steps is not only that are they continuing to work with partner organizations, but also trying to expand the system to other countries and also put other diseases such as cutaneous leishmaniasis. Another type of mosquito, the Culex, as far as West Nile risk, is another way that we can use the satellite data, such as MODIS. And in South Dakota, it actually has the highest per capita incidence of West Nile virus in the US. The goal of this team was to develop a model for mosquito population and West Nile incidence. And so they used the Earth observations to be able to identify as far as temperature anomalies over time, and how that was going to be overlaid with the West Nile cases, and if there was going to be any findings or any differences. And so the findings they found is there is a strong association with the temperature anomalies related to interannual variability in the incidence, and that these associations were stronger compared during the winter and early spring. So we're looking at December to February, March, which precedes the main transmission season that was recognized from between July and September. There's an interesting video that you can look. It's called MODIS Meets Mosquito. You can search, and this is Dr. Wimberly from South Dakota State University. Again, Earth observation data to be able to identify these risks. And the other that they did, they were able to use this data also to identify if they could adjust their budget. So their economic budget allotted for vector control, and they were also able to use that as well. So there's multiple facets of using Earth observation data and the impact of it. When we look at US air quality monitoring, the EPA has been obviously monitoring ozone levels to update air quality standards. That has been reported and very successful to enhance this work. One example is looking at NASA Aura. The instrument of OMI was showing air quality that it is improving. So using this data to be able to look at nitrogen dioxide emissions. They used these Earth observations, and they were able to identify that there was a 30 to 40% decrease in the pollutant of nitrogen dioxide between 2005 and 2011. And basically due to the emission of these control devices, not only with the power plants that were burning coal, but also more efficient fuel cars. And we at NASA, we have a health air quality science team, and these members are able to facilitate this data to the end users and be able to demonstrate the effectiveness that state efforts do have in improving air quality. And finally, looking at another way of satellites, being able to identify some unknown communities that might be at risk for certain diseases such as river blindness. So the Carter Center's elimination program for this river blindness in the community, they administer ivermectin tablets, which are donated by Merck, in the affected communities, and they have been very successful. However, there's been one significant risk in the area, which is along the Brazil and Venezuela border, which is a dense rainforest area. And so in combination with NASA developed teams for their expertise in Earth observations, they were able to use that data along with the National Geospatial Intelligence Agency data to be able to identify and build a suitability model for where the Yanomami villages may be identified. And they were able to make these interactive maps with latitude, longitude coordinates, and with the imagery to be able to identify based on their hut roof areas. And from that, they were able to provide the information to the Venezuelan healthcare workers that there are actually 16 unknown villages that they had identified that they could add to their outreach efforts so that they could provide the medication to these communities that were previously unknown. So there are many different assets, not just identifying, differences in air quality, identifying unknown communities, So that are different assets of using this as the One Health toolkit. We have 2 missions upcoming that I wanted to describe briefly. One is TEMPO, the tropospheric emissions monitoring of pollution, and it's basically looking at the North American components. It's working in combination with your European Union and with Korea to be able to have this geospatial orbit. So like was previously described, going along one area, but now we're covering the entire globe through this collaboration. And this is going to be able to improve basically the data we obtain from air quality. It does include multiple science team members, and it will be scheduled no later than 2021. But this is definitely an exciting moment for those who are in health and air quality. And the second one is looking at the multi-angle imager for aerosols, or MAIA. This is going to be the first air quality application that is going to be going out. And the interesting component to this, it is going to be more high resolution to be able to look at particulate matter along with some other contaminants. And most importantly with this is that it's actually going to be linked with some of the population health data in certain areas. So mega cities have been identified, and that they have been identified as particular for their population health data. So that can be linked with the air quality data, which has been a limitation previously. So again, many science teams from CDC, EPA, NIH, NOAA, and the World Health Organization, again, scheduled for launch no later than 2021. So the idea that now health and air quality has become a priority, especially with these new instruments coming out, is very exciting. With our health and air quality science team, it's basically trying to connect tools with our end users, and all this data is open access. If you go to heycast.org, you can look at the NASA Worldwide, which is an opportunity again to look at the data, as well as view different webinars, which are all free and definitely an asset to our One Health toolkit. In addition to the RSET trainings we have, which is the Applied Remote Sensing Training Programs. This offers professional technical workshops for anyone who is interested, and the idea of also building partnerships with communities or institutions in different across sectors, and offering opportunities that are online as well as in person on how to access, interpret, and use NASA satellite images so that you can use that for decision support and other types of decisions. So these are definitely open to anyone who's interested in gaining a little bit more expertise with Earth data. Concluding some of the future considerations that I feel here in this and as our One Health community is that how can we really strengthen our One Health toolkit? And I keep emphasizing One Health toolkit because we do have multiple expertise in this room, and how we can continue to strengthen that. And if we don't know, we can learn how to collaborate with others who do know that knowledge. So how can we seek those individuals? And some of the considerations that came when I was preparing this presentation was looking at programs that are available for science training and Earth observations. So looking specifically at that capacity building, how can we be able to look at and keep updated with the new technologies that might arise, as well as the implementation of local observations. So that ground data is just as important as that satellite data, and how can we be able to use both linked? And how are we integrating, analyzing, and interpreting both of those? Just as when you do quantitative and qualitative research, you get different information, and when you can combine them, oftentimes you learn more about your research objective. And then how can we increase the use of Earth observations for all end users regardless of their discipline? And how can we be able to communicate amongst each other, being that we are from different communities with different jargons? And so that's definitely something to consider with our expertise. Some take-home messages are basically fostering collaborations. I've been several months in this fellowship, and I definitely have enjoyed this significant steep learning curve. And there's so much more to learn, but I definitely know who to ask and who to consult with, so that I have the basic knowledge, but how I can incorporate it and then seek the expertise of those who do have that. Strengthening communication among stakeholders is increasingly important, especially when we have different jargons, and I've encountered that practically on a daily basis. Coordinating disease surveillance, so being able to use this to be able to predict infectious disease outbreaks has obviously been very successful in many of the projects that I described. And increasing public awareness, again, capacity building with the different end users. If you're in a Master's in Public Health program, it's an opportunity to also be able to increase that toolkit. The transdisciplinary collaborations are important also, that can lead us to identify risk factors and also identify those innovative approaches. So in One Health, we're always talking about transdisciplinary collaborations and innovative approaches, but are we actually doing them? This is one toolkit that we can bring with us, and if nothing more, we know that it exists. If we may not use this on a daily basis for our research objectives, but what kind of approaches can we be able to promote when we do give our presentations and our publications? And that satellite data, in effect, can form part of this One Health toolkit for ourselves as One Health practitioners, scientists, educators, and decision makers. And that's definitely one thing that I hope I prepared for you all today in this presentation. But something that this is just one of the toolkits of many that we can be able to use into our daily work in One Health. And I thank you for your attention.
I guess I have a question.
Sure.
So you're talking about trying to reach out more and make people who are not earth scientists understand what satellite imagery can be useful for and how it can be applied. Do you know what kind of approaches NASA has been taking overall to try and communicate that? I know from DITRA, we definitely use a couple of NASA scientists and some of the research that we fund for work in predicting Rift Valley fever, for example, or things like that in Africa. But I think that's a hard thing to try and message across to a lot of people, even within DITRA, who have half of them are a group of scientists. So I'm just curious what your thoughts are of how better to try and message that. Is it events like this, or is there an actually concerted approach to try and reach across the interagency for government approaches or to other stakeholders?
Yeah, I think that's a really good question, and I have encountered that a lot in this fellowship. In our area, we attend conferences, and so that's a really fascinating outlet, especially for those in the academic and practice community. However, in many of the public health conferences, they see the NASA booth, and many are confused why the NASA booth is there. And I'm there saying we should be there because we have so much to learn from each other. And especially, this is the health area where it can be another toolkit. So conferences are definitely one way, not only presentations, but NASA does this exhibit, which is in the middle where everyone sees it. Oftentimes the limitation at conferences are that we're siloed in our own disciplines. And so we attend the sessions that we want to attend and maybe not the ones that we maybe would be interested or know nothing about. Another way I feel is publications, and that's also very different because when you're in the academic environment, as most of us have been at, and that it is challenging because peer-reviewed is definitely considered the best or high quality, and if you don't have enough peer-reviewed applications, you may not, it affects your credibility as a scientist. However, non-peer-reviewed publications, so the One Health newsletter is one. Any blogs, if there's a newsletter within your own agency, those are opportunities to be able to promote the One Health concept and how it affects your work, because as most of us are in some sort of health discipline, we see health in everything, right? It's definitely one. Those, as well as trying to find different avenues in the community that will offer the opportunity for you to be able to speak and to share. And I guess the continued networking, those would be what I would think off the top. NASA has done a lot of outreach, of course. So it's definitely, from conferences and doing these different trainings. So, and social media, I would think would be one final way. If you follow NASA Earth, I will put a plug in for that, on Twitter, on Facebook, those are different ways you can see. But also, social media is kind of where a lot of the dissemination of messages are coming today.
It seems like a lot of this information and data would have a lot of use to people maybe working in the developing world or in areas with populations that are disproportionately affected by environmental pollution. So I'm wondering if you've had any conversations or if you're aware of any private sector initiatives that are using this information to find populations in need to have the social impact they desire, or work through some of the data to design their business plans or anything like that?
Sure, I'm aware specific. I'll talk more general than the private. Our set trainings, they do go international into different communities, and it is an in-person training session for many scientists in those areas to be able to work on that data. So there is a continued reach out to that. My personal work working, at least in the Spanish-speaking Caribbean, there are limitations, but that's due to just the infrastructure. So there's definitely a lot that we can continue to reach out and to be able to put a plug in for using these Earth observations, especially since the data is open access, and being able to find tools that you can use in any type of environment, low or high income setting. Thank you.
Congratulations for the presentation. It was excellent and very interesting. The examples too. I love the Yanomami one with onchocerciasis because it's very applied to something specific in the field. No? And my question is about other experience abroad, not only US, but like a more easy to to help for the decision makers, not so scientific like this one. And then how about the language for the toolkits? Because it must be excellent to other peoples abroad could use these toolkits to Spanish or Portuguese or French.
Sure. Well, with the last question, the trainings are also in Spanish. So they do some of the trainings in English as well as Spanish. So that does help. Of course, I mean, that's an ongoing project, you know, how to be able to translate different things, but that is definitely working with that. As far as other international, so NASA funds US scientists to be able to do their work. But there are different initiatives with, for example, there has been something called the PEER, which is funded through US aid, that is able to fund different US government agencies or the PIs to be able to collaborate with international agencies that have similar research objectives to be able to do work in their countries where they're the PI. So that is one opportunity. But again, it's also trying to promote the use of Earth observations at the international era. So the other thing that we did have in October was the Group on Earth Observations Week, and that had an opportunity for different end users from different regions. So from Africa, from the region of the Americas, from Asia, from Europe, and so everyone was able to get together. And so there are interagency, international groups that are able to continue to promote Earth observations in their communities. But again, it's also trying to reach the, you know, the health disciplines that I feel sometimes might not be in that sector, just because of the language, and that's something that definitely we can work on to be able to reach those end users.
So you mentioned infectious disease. So I imagine that this toolkit could be used to anticipate where there could be potential outbreaks. So what sort of signposts or indicators do you see in places that are at risk?
So with the toolkit, so I mentioned toolkit because it's just, you know, Earth observations being one of the many things we use, such as example, you know, quantitative data analysis, qualitative data analysis, that we have this toolkit that we can use. As far as Earth observations, the data that we receive are multiple variables of environmental. So the infectious disease that you look at need to have an environmental component that can be identified, which is obviously of extreme importance. So when you look at malaria, for example, you can look at, you know, land use, land cover, precipitation, humidity, among others. You can look at all those different variables, but on some infectious diseases, it's not as easy. So there does have to be an environmental component, which is obviously available in this data.
No, you answered my question, that's fine. But I was just wondering, but from that perspective, it sounds like there's something that's already happened. You know what I mean? Are there data that would help you to anticipate before there is, say, an outbreak? Or, I mean, I don't know what kind of indicators you would see that would lead you to go back and say, hey, something could be happening here. I mean, you mentioned land cover, but.
So it's kind of the example that with the harmful algal blooms. So going back and be able to using that data that, you know, was existing, and you can look because the data the Earth observation data has a date on it. So you can go back retrospectively if it has not been done and be able to identify what were the incidents or temporally, as well as the incidents of, for example, harmful algal blooms. And then you can be able to take that data to be able to make models for the future which was identified by the one PI who identified, when his paper was published in 2012, it was identified for 2014 that there was a predicted outbreak, which did happen, and then they could take the action. So it's doing those types of developing and modeling, which not everyone has that expertise, of course.
So I'm not super familiar with like how intense the satellites can. I know that the satellites are looking at environmental factors, but can the satellites also help map maybe like migration patterns, but of, for example, instead of not necessarily mosquitoes, but like say like birds. Like, I mean, when I think of satellite, I think of like Google Earth and like going and zooming in and looking at people's streets and where you grew up. And so what I'm thinking is like looking at the migration patterns of, for example, waterfowl and how it can spread influenza from different continents, and looking at a lot of the times we don't know when there's been, you know, a spillover of avian influenza into a human until it actually happened. So can satellites, I guess, be able to capture when certain birds or certain animals are migrating from one continent to the other and use that as a way to, I guess, forecast the potential for certain zoonotic diseases that are at risk to spill over into humans?
So satellites are several kilometers up, and the resolution varies across. So a lot of what you're determining from that are environmental factors. So the drought, or just the water, you can see in some areas there are droughts, in some areas there's not. So I don't believe, and correct me if I'm wrong, you can identify specific animals.
Okay.
That's why the local data sometimes, is just as important, but looking at those environmental factors, if there is a drought in one area or the lake has dried up, then the animals most likely would not be going there. So I don't know if certain proxies could be used in that regard, but.
Maybe like the change in environment, or like that animals may live in and how they might make them change and go from one to the other. Like that.
Is that correct?
So you're right that the satellites can see many different things, and so a lot of people know it from what you see on Google Maps and the satellite view on Google Maps, and so that's what people are most familiar with. But as Helena sort of talked about, there's many other types of things that the environmental satellites at NASA and many other government agencies have to look at temperature and aerosols and relative humidity and sea surface temperature, sea level height, and so there's a whole range of them. More than sort of identifying any particular bird or waterfowl and all that, I think what we could do is, if knowing when the birds would be migrating, you can look ahead to sort of see where are the conditions right for which they might need to be resting over, and that might serve as a course tool. Then you could then go out to the field and maybe do sampling, and so it can help you know strategically where to position your resources so that you can do the on-the-ground monitoring, and you'll know which areas to do that on-the-ground monitoring. So that might be the way, in this particular case, how you'd want to be using the NASA satellites, is to go from where the heck should I look, and that would help you sort of cue you into where to go look for your more on-the-ground monitoring. So we actually have a project that we did with Nature Conservancy, looking at the Pacific Flyway and looking at birds, but I can relay that to you.
But again, that's
we can send a story around through the network.
Thank you, Lawrence. And that's definitely another example of using that remote sensing data with local observations. That that how can we start to link them to be able to improve what our product is.
First, I want to really thank you. I think this is very important. This is part of the dissemination and part of getting people in a variety of disciplines to understand what's going on. And I think I actually think I have a couple things to say. One is sort of going back to this question that we just had. Having worked on the last 10 years on attempts to integrate data across agencies, WHO, FAO, one of the things that I think is important, which is why I think what you're doing, is that people have lost the capacity to date things and locate things. It's as if the world is this wonderful big, and we're all helping everybody else. So it's really important that people identify location, because time and place are culture. And what you're really saying is that we now have this technical capacity to see the Earth as a whole and see some of the very real geographic variables that are influencing people and those decisions. So I would offer that what's very important is to get people to think about layers of data. That you're talking about a fundamental layer that I have learned that people completely ignore, and that's topography. We need to get people to think about health as a geographic component. It's not just animals, it's not just but it occurs in a very real place. So I think what you're doing, and I really, really appreciate this, because I've been, you can tell, raised the flag many times saying, where is this happening? There are these wonderful abstract social network maps that people are trying to see. Is this people are relating to people? Well, that occurs in a place, just like birds fly in a certain place. So thank you very much for showing us that this kind of work is going on, and that, yes, I'm sitting here with exclamation points. We really need to educate people. We need to have people remember that as a species that we are part of a planet, and make sure that everything, I'm going to add to your takeaway, make sure everything is geolocated. Where did the document get published? Where is the actor who's in charge of the funding of the next thing? Put everything and make that real. The other thing that I think is related to that, and I think this is a disciplinary issue, is that I mentioned I'm a social scientist, I'm a sociologist. Oh my God, sitting in meetings, I'm telling you, with epidemiologists and biostatisticians, it's like knocking, in a huge steel door. They don't understand that there is something to do, that what we do, we study social systems within which people have health issues. So I would offer that there need to be far more of these discussions in the medical profession, in epidemiology, to bring in location, because location makes humans what we are. So I think there's two things. One is just sort of the general public to show that this is useful, and two, within our disciplines, to find the courage to raise your hand and say, why isn't this geolocated? Everything. All right, thank you for your stuff.
I was just going to call to mind that in the veterinary field also there have been many, many different examples of where disease has spread from one region to another through things that can probably be observed through some of this sort of data. I'm thinking of foot and mouth disease, for instance, and when it went into Denmark so many years ago from Germany, and there was never any explanation, but the excitement was around this possibility of wind plumes and things of this nature where the virus actually carried across. Think of locusts, for instance, that can come across from Africa and wind up in Barbados and places like that. There's just a number of things like that. Then the other area is just in the conservancy area, populations of animals. What happens to these populations over time? It's easy to realize that we're losing populations all the time, but there are things that could be said about this in anticipation, and perhaps even avoid some of the elimination of certain animal populations based on the fact of the ecology and what human influences there are, and what some of the natural disturbances are that also affect this. So there's just so many applications.
Some people have raised really good points, but I have more of a user interface question. I tried to, I ended up using different sources, but used the Landsat and the Motor for a spatial epidemiology project. And I'm just wondering, with the toolkit, is there going to be sort of training modules on how to actually access that data? I found specifically looking for specific locations, and maybe it's because I was brand new to using NASA's data, but just on finding the exact location, say just like even within the country borders, was quite it was a challenge just to get through downloading all the files. And I'm just wondering, from an interface sort of multidisciplinary, people who are not necessarily used to downloading zip files and and all this kind of stuff, just is there a plan to make it very accessible to everyone?
I have heard that question a lot.
Okay, yeah, 'cause it was a challenge. I mean, I went to my university GIS person and they did click, 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 and you know, got it all organized for me and helped me sort of get it organized. And I just, from a perspective of someone who has no experience with GIS, or, you know, that would be the first step, but in the future, because I think it's very useful for lots of applications. It's starting to become this, it's with a lot of data sources, I find it's starting to become a challenge. There's so much data that you're trying to pick through.
So if I could say one thing about that, or just
Yeah.
quickly. So unfortunately, this is what I do. So I work in the Center for Data Analysis, and one of the things we were doing for several different agencies is trying to implement something in this direction almost 10 years ago, which is create standard data models across the government. It is highly resisted at a lot of different levels for a variety of reasons. It's also a major cultural change, which is what this study was kind of talking about. Exposing data exposes what you've been doing, and people don't particularly like it. Integrating data is a lot harder than it looks. It's because people have created proprietary systems across the board to create this stuff. So putting them into a common format, creating metadata, creating data models so people can actually see where this is all coming from is not easy. It's very, very hard in a couple of different ways. But even beyond that is that people get very excited about their little boxes that they own and they don't want to share. So there's a huge amount of satellite data available from a host of different sources. And I even teach for NASA, but I won't throw a rock at them, but I'll say that NGIA just recently opened up almost everything in their archives with a handful of exceptions. And NGIA has huge amounts of data. We've been surveilling the Earth forever for a variety of reasons. And actually the Earth, not just where people live, but in lots of other places. You know, we only live in less than a third of the planet, so there's a lot of planet we don't look at. But there are a lot of reasons why other people didn't do it. But getting to that is not always easy. Your problem. How do you get to this? How do you find it? How do you make good use of it? It's coming. Actually, there's an OMB Directive 1722 that now has gotten some of my folks excited that says we should just create a micro layer on top of the existing data and go beyond that to try to integrate data from here forward and kind of forget the rest of it. Well, amazingly enough, not everybody likes that idea, but we're trying to make everybody happy. We want up and figure out how to do the down. The down is very hard in the sense that people have a lot of reasons they don't want to do it. Things, again, were built for very specific purposes. They're they're in a whole different set of languages and structures. But having said that, it's been 10 years now, the US government in theory has been moving toward at least a common data structure, common metadata that you can find exactly what you're asking for. Show me all available data for Key West, Florida. You know, that is this time frame to this time frame, daylight only. I don't want to, you know, et cetera, you know, because that's why I want to see the beach. You know, so I mean, if that's what you're looking for, then that would come from a host of different sources. So it's a real challenge going forward because we're so used to living in silos and people want transparency, and it's actually very much demanded. The other reason we're doing all this, to put it in another context, is big data analytics and artificial intelligence. But all that stuff doesn't work unless you have standardization. And so you go in and talk to people, you talk to all these admirals, talk to all these senators, all these guys are like, why don't we have it? I don't know, when do you plan on standardizing your data? You know, how much money do you suck in? You know, so if you could ever get to that point, it makes life work. It will make things work. In the meantime, we're kind of starting since 17, kind of going up, trying to integrate. But that would be a lot.
I'd like to get back on this because I'm involved with the UN governance issues around SDGs. And there are, and this is really to your point, because I agree, I've been at this for 10 years, and you just keep asking, how can we make it better? The idea of standardization is incredibly difficult for people to accept, very difficult. And one of the things I think that's important, though, is that, and you mentioned the SDGs, this may be an opportunity, and maybe those of us in this room are one of the places to start, because health indicators are used for a lot of outcome analysis. But I think there is there's a UN committee called interoperability. And they're focusing on this discussion. I don't know whether I know USAID sometimes has somebody in there. But again, I don't, it sounds like you're coming from more the DOD kind of background.
I'm kind of the big agency background. I'm talking about HHS. HHS just recently came to us and said, we have all these research archives, and they go off for hundreds of years, tens of years, decades. You know, they don't talk to each other. We can't even figure out what we got. The titles don't even actually add up. Can we fix that? Again, how much money did you say you had? Yes, we can fix it, but it's, yes, that's fine. Yeah.
And the thing
This is across the government because.
And that's just the US government. That's just the US.
No, it's across the world.
Exactly, that's the point. And that for the health implications, it's very important that the US be seen as a partner for what's going on around the world. So again, I think this might be a platform for those conversations to go forward. Because I've just learned about your work. You're just
and everything she's talking about. So when we did the hurricanes, Katrina and all that, we used a variety of assets to do a lot of the things you're talking about. Well, that's about 10 years ago. Now anybody remember what we did, how we did it, or where it went? Well, we were forecasting where mosquitoes were coming from. We were forecasting where we're going to have water issues, et cetera, et cetera. We were doing that real time at the time it was happening. When we shared that with many people, it was in the FEMA DHS world. I was the first medical advisor in DHS. Did we share that with anyone? Anybody that listened, but nobody really, and it just sort of went away. So a lot of this stuff, people tend to live in their silos.
I just wanted to ask, so from your perspective of the big agency, is the transparency question, like, is it going to happen, or is entirety still of data? So, because I'm from Canada, and it's a big issue with our data sets. Like, you know, you go through several checks and balances so you can get access to health data. So it's becoming a bit of a flaw, I would say. But I'm just wondering, curious if the U.S. agencies and government are open to transparency, or
yeah. So the default answer is we're supposed to release information. That's the default answer. There are there's a bunch of different exceptions on how you can hang on to it, but the default answer is that taxpayers pay for it; they're entitled to it. That's the general answer. It's coming slowly in bits and pieces. And your problem is that people are trying to make money again. No, but I mean, because there's a smaller number of people that generate that data.
Obviously, there's a long way to still go, and I think it's a great place to kind of leave off. I mean, I think we've heard some of the real applications here and some of the interesting research that's going on, but also a lot of the challenges that still remain too, and at least we've all been exposed, and we can all be ambassadors for trying to make data more universally, approachable, and also being aware of the uses for remote sensing. So I do want to thank you though, and our tradition here is we always give a flag to our presenters. It's been flown over the Capitol. That's our One Health Academy tradition. So there you go. Thank you very much. Appreciate it. And I know we're going to be booted out here in a few minutes, but if anybody grabs food or drinks before you leave, feel free to throw things away in the garbage. We'll have our last talk for this year. We then take a summer break, and that'll be next month. But we'll have Dr. Shel Stroud, the Executive Director of One Health Commission, coming to speak. And One Health Commission is actually the one who sponsors our webinar platform. So it'll be great to hear what's going on from her perspective. She has a lot of great connections, both domestically and abroad, about One Health in general. So